Welcome to the wonderful world of wellness with Dr. Andy Mencia. This medical program heard from 7 to 7:30 each Saturday right here on WSBR 740 AM is brought to you by the Adult and Geriatric Center under the medical direction of geriatrician Dr. Andy Mencia.
Well, good morning again.
Are you still here?
I'm still here. Threw me out the door, but came through the window.
Well, let me just ask you a question, Dr. Mencia. You bring on not only the most distinguished and educated physicians, but they're
the most beautiful.
I know. How do you do this?
I saw Dr. Kathy Garcia in Las Vegas dancing. And I said, what are you doing here? He said, just an exercise. I said, well, you just come to Florida and let's have some fun and treat some patients. And she said, okay, I'll stop dancing and go home. And her wonderful husband, Dr. Rodriguez, who I, have the pleasure of working with some of my obese patients.
We had him on the show.
Exactly.
Recently,
it was one
right?
of the guests on the show.
And he wrote the article, a wonderful article.
Excellent article. We had so much
issue.
feedback. I'm still getting feedback on the article he wrote.
Nobody wants to be obese.
Right.
This was the osteoporosis, I think. This is a different show. No, this was the one last issue in our October issue. But Dr. Mencia, seriously, Dr. Catherine Garcia, who is a rheumatologist, if you would look at her, I mean, I just hate to even say that. I mean, she is like a teenager or a cheerleader from somewhere.
Yes.
And then she has these credentials that are marvelous that she's a rheumatologist.
Such a smart woman and a great professional, and I'm so happy to be able to work with her and my patient, to have the privilege. She's going to be working both offices, Boynton and Fort Lauderdale. And in Fort Lauderdale office, you already have a waiting list. People getting on standby just to see her. So
why do people have rheumatology?
A lot. Well, as we age, we get a lot of joint pains, and they don't know how to treat it. And sometimes they just go to the doctor, and the doctor might give you just pain medication, which is most of the time the wrong thing to do. You want to get to the bottom of why you're having that joint pain. I can tell you a joke before we introduce Dr. Garcia.
Is it going to be clean? Can we let
No, it's
Catherine?
A clean joke. It's below the hip.
I don't know how clean that is. Okay, go ahead.
This old lady got to the doctor, and she said, Doctor, my left knee is killing me. So much pain on my left knee. It looks swollen. So the doctor said, just take some Tylenol, and you'll be okay. So she go home, and she take Tylenol every 4 hours as indicated. And it doesn't go away. So at the end of the day, she called the doctor again and said, oh, my God, not you again. Yes, my knee is killing me. You have to do something about it. Okay, take ibuprofen. That sometimes is better than Tylenol. So she take ibuprofen overnight, and she take it more than what the doctor was saying, and then it was killing her. The next day, she goes to the doctors and they say, Doctor, you have to do something about my knee. This is really, really killing me. This is not right. And the doctor say, honey, you are 93 years old. So it is okay for your left knee to be killing you. And she goes, Doctor, I am not an MD, but I don't understand why my right knee that is also 93 years old is not killing me, just my left one.
Oh, touche. That was perfect.
That is a perfect answer from a patient.
Yes.
So, Catherine, is age a factor in having problems with your body and why a rheumatologist is so important?
Well, it is. As we tend to age, the wear and tear that we accumulated throughout life, the small injuries, the overuse of certain joints, it's normal to have some sort of discomfort, aches and pains, especially when the weather changes, when it gets a little bit cooler. But there's a problem when you have limitations that you didn't have before, when the pain is all of a sudden new, if you have swelling, warmth in a joint, and as Dr. Mencia's joke, if the other joint is looking okay, but you have a problem in the opposite one, then, that's usually not normal. And it's good to get to the bottom of why that is.
And is it also, sometimes people in their younger years have fallen you know, and they hurt themselves, and then they get better. But then they say as they age, it seems like it falls on that particular place that was injured.
Well, the body has a great system for healing, but it's not 100% in some cases. So, for example, you can have a woman, let's say, that worked in a salon during her earlier years and used, let's say, her dominant right hand over and over, stressing that shoulder joint over and over. There'll come a time, late 40s, 50s, 60s, that they may develop frozen shoulder, arthritis of that shoulder, and, you know, to a point that they may be even discapacitated from that joint. And it's not necessarily because there's something new, but there's something cumulative that happened over all the years.
That makes sense. And then what about, why would someone come to you? Are they going to be recommended by Dr. Mencia, or they just find you because they know that they need a rheumatologist?
It happens both ways. A lot of the times we get referrals from primaries. When a person has a painful joint, a swollen joint, red hot swollen, 1, 2, or more joints, and or muscle inflammation, or maybe even osteoporosis. Any of these things that was treated initially by the primary, but in some way has become a little bit different than the norm. Let's say they tried first the Tylenol, then the ibuprofen, and it didn't work. Or that the primary sees something that just isn't quite right. This doesn't seem like your typical wear and tear arthritis. This seems like something more. Could you please see the patient and help me out with to figure out what is going on exactly?
And one of the things that, we love to do preventive medicine in geriatric because we get a lot of the baby boomers on up. And, my recommendation is see your rheumatologist early in the game, where she can give you the green light and say, no, your problems are okay. You don't have a big problem. And don't wait when it's too late, because then the treatment can be quite different if you allow something to become a chronic problem. And we have one patient that is on the waiting list to see you, that he had an arthroscopy of the knee. Mm-hmm. And before he came to us as a patient, he said, when I bend and when I stand, that leg, I have to take my time, exercise the joint, then I can go ahead and walk, which means that problem now is very advanced. So I ordered some X-ray, probably Dr. Garcia would need MRI, or, But in the meantime, just listening to his complaint, he had let this problem gone too far. So a lot of time, and you can speak about the risk of, let's say, after surgery.
Is key in these conditions because, for example, rheumatoid arthritis or psoriatic arthritis, these are an inflammatory type of arthritis that really requires more intensive therapy. I mean, this is a joint, or these are joints that are going to suffer damage, irreversible damage, if it's not caught early, treated early, with some sort of immunosuppression. I know it sounds very, very scary, but actually that's what these medications are for, to prevent. I mean, years ago, you would see that patients would be have complete hand.
Very crippled, yeah.
They were crippled, exactly. That is the perfect word, crippled. And we rarely see that unless the person, is in the middle of nowhere, can't get medical attention promptly, can't get the medications that they need.
Or neglect themselves with the conditions.
The other thing is that people think, I'm just getting old. This is a normal part of getting
old.
One
leg.
Exactly.
Well, no, even hands. Because let's say, and I've heard this a lot, women think, I'm just getting old. My mom had this. So it's nothing. It is the way it is. Well, medicine has come a long way. You don't necessarily have to have your mother's hands. There's things that we can do, even if it's osteoarthritis. There aren't any fancy new medications, but there's a lot of things we know of how to prevent further damage or prevent, the crippled effect, or the crippling effect of these things now.
Right. At the end of the day, it's quality of life. That's what we all want. We want, if you are playing golf, you want to be able to continue to play golf.
Yes.
If you play tennis, you want to continue to play tennis.
Yes.
Or, whatever habit you have or sport that you like to do, you want to be able to continue regardless of your age.
But Dr. Mencia, don't a lot of your patients come in and say, oh, well, I just have arthritis?
Correct.
Everything.
Correct.
Everything I have, it's arthritis. They
but
blame
that's,
it. It's Mr. Arthritis is in everybody's house, right?
What type of arthritis?
Okay.
Exactly.
There's over 100 types.
Well, tell us about that.
Well, there's over 100 types. And
We don't expect you to tell us about 100, but of course. But tell us about that.
But that's why it's important to see which type of arthritis. Is this just the menial wear and tear arthritis, the everyday, let's say you worked with your hands all your life, now you have nubby fingers that are stiff a few minutes in the morning? Okay. Yeah, you can deal with that. But what if it's something more? What if you're stiff, swollen, and impaired during most of the day? What if you have swelling? What if you have so much swelling that now your nerves are getting pinched? Now you have carpal tunnel. What if you have so much arthritis and swelling that now, you have a stiff low back and you can barely move? So it really depends what type of arthritis you have. And that'll depend on how easy it'll be, what quality of life you will have.
Is it hereditary, as you said, if someone had the one form of arthritis?
Yes, many of the arthritis and our conditions in rheumatology tend to run in families. Yeah.
Huh. And is it male or female?
It depends for which.
Oh, really?
And for which joint. So.
Really?
Oh,
yes.
interesting.
Yeah. So
this is interesting.
So hand osteoarthritis, where you see that the people have really large knuckles. It's not really swollen. It's just, let's say, really knobby fingers. That tends to be more in women and less in men, although men get it too, depending on their professions or what they do for a living. I think hip and knees also tend to be more towards the men during the earlier years, but then it equalizes in terms of female and male distribution, and that doesn't tend to be as much as hereditary as hand osteoarthritis. So it just really depends.
I'll bet now with the computers, you're seeing a whole different form of arthritis, aren't you?
Yes, and actually there was something called BlackBerry thumb when BlackBerries were really in style. Yeah, because you had the constant mechanism. I wonder if there's an iPhone thumb around there somewhere.
But you do, sure.
Yes.
People are probably coming to you with that.
Yes. So yeah, it's important, and it's not only joints. Sometimes in conditions like rheumatoid arthritis also can affect your heart. It increases your risk for cardiovascular disease. It increases your chances for inflammation of the eyes, and all of these things can be prevented or improved upon with the proper use of rheumatoid arthritis medications, which, by the way, isn't only over-the-counter anti-inflammatories. We have a whole host of great medications for this.
And that's the beauty of us working together as a team, because we have the ophthalmologist at the center that we're able to work with Dr. Garcia. We have the podiatrist, because once the toes start deforming on you, then it becomes really hard to wear shoes. You have to buy new shoes. You need special shoes wear. So that's where the whole team come together for the patient to maintain that quality of life. But the earlier you see Dr. Garcia, the better quality of life you're going to have without all those other specialists.
And I don't want to forget that we're going to have our first open house at their wonderful new Boynton office. And I want to tell you that's going to be next Friday.
You have to call an
23rd.
LSPP because the list is getting long.
It's getting long. They're going to have lovely food, and they're going to have Dr. Mencia will be there, of course, and we're going to have Dr. Garcia and her husband.
And Dr. Rodriguez,
right,
yes.
Rodriguez. You kept your separate names. I know it's because you're physicians. Okay, well, let you
so
get
many
away with that.
so many diplomas.
I know.
and certificates.
Too much. But it's from 2 to 7, and it's going to be 2 to 7.
2 to 7.
And it's going to be on the 23rd. That's the day before the Cure Symposium, which Dr. Mencia is going to be one of our 10 distinguished speakers, and that's over at Palm Beach State College. But make sure you get over, and this is the phone number to call to get directions. It's 561-270-6494. That's the Boynton Beach Medical Center, 561-270-6494. Remember, next Friday. But for today, if you want your flu shot, you can go. Oh, they're open too?
I just checked with Courtney, and during the open house, they are going to have a booth to give the flu shot.
Booth for flu shots.
So if you didn't get your flu shot,
but if
just
you want
bring
your flu shot today, you can go down to their Fort Lauderdale Center, which is on East Commercial Boulevard, and the phone number there is 954-489-1345. That's 489-1345. And remember, this is Pencil Talk Radio. If you just write these numbers down, put it on your refrigerator, you always have them. And remember that home visit services are available for homebound patients. It's rare to find a medical center with the high quality that Dr. Mencia assures you to be able to go to your home. I don't know how that's working for you, but
the home visit exploded in the past month. We now cover Tri-County, so we cover Miami, Broward, and West Palm Beach.
I respect you.
Really
I've always respected you, and I've always admired you, but since you've been doing home visits, that is for me, because I've had such a personal experience with that, the most wonderful thing that you could have done. You should sleep very well at night, knowing that you're helping so many people at home.
We have a wonderful team of physician and nurse practitioners that make it all happen, and the medical assistant, because they will go to the home and they draw the blood,
flu shot at home.
Give the flu shot. They go fully equipped. They can do from a bandage to an ear lavage, because they go equipped to take care of that patient as well as we do in the office. These are homebound patients, and they deserve just the same treatment that we provide. And when they do come to see the dermatologist or the rheumatologist or the eye doctor, we try to bundle those consultations so that when the patient do have to come out, they come to one center. They don't have to go all over town to get their medical care. They come to one center, and everything gets done and taken care of there.
It's a great thing that you have created.
And
what else? What else?
For the first time now, we're going to add dental to the home visit program. So the dental department is happy to join us to provide dental care for those patients, because as you can imagine, if you are homebound, they are neglected when it comes to dental care. Some of them, they lose their denture, they go in the garbage, and you see them walking around without denture anymore because they cannot go to a dentist. So we will go there if we have to make denture for them. If we have to do extraction, we'll do simple dental care, cleaning, simple stuff that can be done at home will be done. So the home visit program, I'm very proud of that.
Well, you should be. I'm proud that you do that. Well, Dr. Garcia, let's get back to you. Catherine Garcia, and you are, you look young, and I'm not going to ask how old you are, but I know you're young. And I know your experience, though. You just kept yourself in really good condition. So my question is this. Why did you decide to become a rheumatologist when you could have become anything in the medical field?
Oh, no. Rheumatology is fascinating. It's fascinating. And actually, for a few years, we were the happiest doctors per a report online on Medscape. So
the happiest
doctors?
Yes,
the happiest doctors.
Why is that?
The most satisfaction. Well, I mean, we have a good quality of life, for one, but in essence, we develop lifelong relationships with our patients. Usually when a patient has a condition like lupus, like rheumatoid arthritis, like psoriatic arthritis, they see us, and they need to see us, as long as their condition is active, and we tend to monitor medications. And it's really great to see a patient go from unable to open a can of whatever to being able to do all their regular activities and be functional and productive. It's awesome.
Is it
It's
good?
rewarding for the patient and for the physician.
Exactly.
Yeah.
And how about massage? Is massage a good thing to keep your body that...
Yes, so physical therapy, occupational therapy, Tai Chi, yoga,
Taekwondo.
massage, yes. All of these things, when done, knowing well what the underlying condition is we encourage it. For example, chiropractic, if there aren't any significant spinal issues that go along with their conditions, that is perfectly well as well. So yes, massage, perfect. But what I would like to stress is that these things alone generally aren't what's going to provide relief, because we have to get to the underlying problem, which may be an inflammation, which may be, for example, a knee pain. It can be a leg length discrepancy, just as simple as that, or a hip pain. It can be a bursitis or an inflammation, and it's a matter of getting to the bottom of what's causing it, how we can correct it, getting orthotics, for example, correcting the discrepancy in the leg length, simple things like that. And then the massage will help those other measures that we're taking.
I don't want to let you go since we're talking about, and she's writing an article.
Is she going to write our article for our November issue?
For rheumatologists, right? For the people that follow us on Boomer Time. But I don't want to let you go today since we're talking about joint stiffness and pain. Mm-hmm. Some patients, they develop that sausage-like fingers. Yes. And they say, what do I have? Do I have arthritis, or do I have something worse that I need a rheumatologist to look at me and help me distinguish? Because it's not sometimes people think it's very simple. It's arthritis. I'm just getting old. But I put my hand in the refrigerator and my hands now get very painful. Mm-hmm. Or if I run my hand under cold water, so I think, no, I have to use hot water. Why don't we talk about that?
It's good not to brush it off, because a swollen digit, if your finger actually looks like a sausage, that's not normal. So it's always good to talk with your doctor about those symptoms. Sausage finger can indicate that you either have some sort of inflammatory arthritis like psoriatic arthritis. That's the common description for a psoriatic arthritis. There's a famous golfer that advertises for that condition on TV,
right.
And one of those great medications that we now have. So that's a classic description, a person that has a sausage finger in psoriatic arthritis. But there are things that can mimic a sausage finger, like gout, where a finger can get very swollen, red, painful, and it can actually end up looking like a sausage.
And toes.
Toes, exactly. Sausage toes, sausage fingers, or even an infection. So it's always good to if you have something that wasn't there, something that's new, something that's out of the ordinary, just don't chuck it up to age. Figure out what that is, because
now, Raynaud, Sjogren, can those conditions affect your hands also?
Yes, but in certain different ways. So Sjogren's can affect nerves, so you can have tingling, numbness in certain body parts. It can cause neuropathy. So a lot of our conditions can cause all sorts of pains, not just in the joints, but also nerve type of pain, muscle type of pain, and it's important to get to the bottom of it.
So, Dr. Mencia, your patients, then, when they come in and you're examining them, I know you're such a generalist, too. You can understand when it's appropriate to refer to a rheumatologist and when it's not. Right. That's really the key, isn't it?
Exactly. And the beauty of the show that we do is that we try to educate people, because a lot of times they have those quote-unquote neuropathy, and it could be a person that have diabetes. So if you already have diabetes, it's because you are diabetic, that's why you have the neuropathy. And you can have more than one thing.
Yes, of course.
Yes.
And your diabetes is well controlled, then why are you still having or why did you develop it if if your diabetes is so well controlled. So it takes a keen eye in part of the primary to kind of know that there's something more going on here.
Well, one thing about Dr. Mencia, and I have really labeled him, it's a new label, and he is a diagnostician. He absolutely is. People don't know what's wrong with them. Go to Dr. Mencia as a diagnostician, because one time I tried to find one years ago. They don't have diagnosticians, not like you are. So for people who don't know what's wrong with them, whether it's, something that might turn out to be arthritis or something else, go to Dr. Mencia, and I will give you that phone number again, and make sure that you set up an appointment. You can call him at his Fort Lauderdale office at 954-489-1345. And yes, Dr. Mencia, the listeners have learned a lot, but Anita Finley has really learned a lot since you've been on all these years. I know so much. I mean, I really ought to get a medical degree from you, personally. Anyway, thank you. It's really been wonderful having you here, Dr. Catherine Garcia. And Dr. Mencia, we will see you on the 23rd in Boynton Beach at the AGI Medical and Dental Centers. And I know that your husband has been sitting here so quietly. Great article, by the way. Anybody who hasn't read the article that Dr. Ariel Rodriguez wrote, page 4 and 5 in the October issue, read it. Thank you very much. Bye. Thanks for listening to The Wonderful World of Wellness with Dr. Andy Mencia. Be sure to tune in each Saturday morning from 7 to 7:30 right here on WSBR 740 AM.